Okay, to treat the suboccipital musculature, first of all, we're going to locate the base of the skull, slide our finger down until we feel a bony prominence. In fact, go ahead and give me a chin tuck, please. Okay, with the chin tuck, as I slide down, the first bone I run into is going to be the spinous process of C2. If I then move my finger diagonally here, I will be on the rectus capitis posterior major, where I can go ahead and locate the top bands and find the tender nodules here. And from that position, after I treat the rectus capitis posterior major, if I slide up to the base of the occiput, slide my finger slightly medially, and then have her press back, the rectus capitis posterior minor will tighten up. Again, I can put some very slight pressure on that. Remember, there is a connective tissue bridge going from there to the dura. It would behoove you to be very gentle in this area. The other issue we deal with here is the vertebral artery, and so prior to doing this, you're going to want to be able to have the person extend their head back. In fact, it's best if you sit the person down, just look like this and see if their eyes begin to bounce around in an nystagmus. And if so, that would be an indication to not do this therapy. The next thing we're going to do is find the mastoid process, and just below the mastoid process is going to be the transverse process of C1. If we go between C2 and C1 all the way across, that's a fairly large area and is the location of the obliquus capitis inferior muscle. Again, we can put some pressure right down there to get it, and this way we will have now treated 3 of the 4 muscles that are considered to be the suboccipitals. To get the next one, we're going to locate, here's the transverse process of C1. We're going to come superior and slightly medial and have her press back against me, and when she does that, I can feel the contraction of the obliquus capitis superior, and again, just very light pressure in that area. I would be treating this on both sides. At the completion of that, I would want to give her, I would want to stretch this out for her. Now, she can stretch this out herself with a chin tuck exercise. In order for me to stretch it out, let's have you go ahead and sit up for me for a moment, ma'am. Let me get my pillows out from under you. And on your back, head back up this way. In order for me to stretch in this area, what I would be doing is simply bringing her into a chin tuck and maintaining a hold under the occiput. And so this would be a nice passive stretch in addition to the active stretch she can do with the chin tuck. And again, one of the things I'm making sure not to do, I'm making sure that I'm not doing the normal technique of reaching underneath and holding up on C1. I'm simply trying to take the occiput and do a slight stretch.